October is Breast Cancer Awareness Month, and I hope that those of you that have been putting off getting a mammogram, that they're kind of, that it's coming to the forefront of their minds and they're not putting it off any longer. Please get your mammogram. Screening mammograms are meant for women starting at the age of 40 because breast cancer is the most common cancer in women. And screening mammograms are meant for women that do not have any symptoms that would be a concern for possibility of breast cancer already there. If you do have a lump, that's a different route we go. But if you don't have any symptoms, you need to get your mammogram either every year, every 2 years, starting at the age of 40, 50 and above, definitely every year. And even if you don't have family history, you still need to get your mammograms. As a matter of fact, the vast majority of new diagnoses of breast cancer I see in clinic every day don't have significant family history. So don't let that falsely reassure you that you somehow are immune to breast cancer. Now, if you do have symptoms, for example, if you have a lump that you just felt, or a lump that you felt a while ago and you're like putting it off and you feel it getting bigger, or a change in your skin color, some itching, some, excoriations is what we call it, redness, itchiness, scaliness starting in the nipple area and moving out, pulling on the inside of your skin, especially when you lean forward, part of your breast is pulled like as if it's pulled inside by a string. If you have a lump under your arm, if you have a lump here, above or below your collarbone, all of these are symptoms that are worrisome. Even if you are pregnant, even if you're breastfeeding, although most of the time this ends up being something benign like inflammation of the breast tissue or abscess, but sometimes it's not, and I've seen it firsthand several times. I don't want to scare you, but if you are seeing this and you have a lump, no matter where you are in your childbearing age or your postmenopausal, especially if you're postmenopausal, you need to seek care immediately. You need to get this looked at. Now, screening mammograms are meant for women that don't have symptoms at all, as we've said. Diagnostic mammograms, in addition to something else like ultrasound, sometimes MRI also, those are all diagnostic studies that are necessary in women that we highly suspect that they have breast cancer, of course, in addition to biopsy. So what are the risk factors of breast cancer? So smoking and drinking are like a big all-time, like all cancer risk factors, both of them. And they are also risk factors for breast cancer. Beside that, things that have to do with your environment. If you're generally overweight or obese, if you're, of course, if you have family history, that's a no-brainer. Even if you don't have a family history, if you have multiple breast biopsies in the past and what that biopsy showed is also important. If you come up with something called atypical ductal hyperplasia or atypical lobular hyperplasia, of course, stage 0 breast cancer, DCIS, or non-invasive breast cancer, all of these are, and proliferative change, fibrocystic change, all of these are benign conditions that can portend higher risk of developing breast cancer down the road. So if you had multiple breast biopsies, regardless of what that is, but even if we know what that was, the biopsy came out, what type of benign lesion that was, can add to our, worry or your risk, add to your risk of developing breast cancer. When you developed, or when you had your first period, so menarche is what we call it, and when you entered menopause, and the earlier you have menarche and the later you have menopause, exposes your body to a longer period of estrogen, progesterone, which are the sex hormones that are implicated in the risk for breast cancer. So pregnancy, on the other hand, the more pregnancies you have and the younger you are, younger than 30 to 35, that tends to be protective against breast cancer. And also breastfeeding. The longer you breastfeed, the more the protection that offers you. But honestly, at the end of the day, I can't tell you that, oh, you've had several pregnancies in your 20s, you've had a very late onset of menstrual periods, and you're not menopausal yet, that, oh, you don't, and you've never had a breast biopsy and you don't have a family history. It's true, your composite risk is going to be lower, but it still does not mean you shouldn't get your screening. So just be rest assured that these are all factors that are protective to you, but just get your mammogram, please. Oh, other factors are how long you were exposed to contraceptive pills or other methods, and how long you received hormone replacement therapy if you're postmenopausal. And these are, data has been very conflicting regarding contraceptive medications, and hormone replacement is a little more set, but those are also risk factors. Now, once you're diagnosed with breast cancer, even if you're not diagnosed with breast cancer, but who gets genetically tested? Well, it's such a complicated topic, and whenever possible, please seek the help and the explanation of a specialist. So if you want to see a geneticist who is a medical doctor by training, but subspecializes in genetics and genetic medicine, and they also will have in their teams, they'll have very, very highly astute and highly experienced genetic counselors. That's all they do. They go to school to be genetic counselors, to know the very different, cancer syndromes and cancer conditions, or hereditary conditions that are even not cancer, and they can offer you the appropriate and the proper counseling and order testing and explain the results to you. However, I come from multiple community practices in the past, and I've carried out the counseling to my patients as a medical oncologist. So this is something that can be very easily done by your medical oncologist, to talk to you about why you need to be tested, what things that are about you and about your cancer and about your history and family history included that make you eligible for cancer testing. If we do cancer testing, what are we testing, and what do we do with a positive test, depending on what comes back positive, and explain the difference between the variants of uncertain significance versus pathologic variants or likely pathologic variants. So this is a very complex topic that I can gladly make another video about. If you so wish, you guys can tell me if you want that. All right, I wish you the best. Pink out.